We start with this. Health workers are the frontline defense against COVID-19. However, in the Western Cape, many have been infected by the virus. There are over 600 doctors, nurses and healthcare workers who are actively infected with COVID-19 in that province. About 1,100 health workers in both the public and private sectors have recovered. 17 have died. More than 21,000 health workers have been given flu vaccinations. The Western Cape government says it's increased the PPE stock for hospital staff. Currently, the Western Cape has just under 11,500 active cases. Health Minister Dr. Zweli Mkhize says that private and public sector nurses as well as professionals are being recruited to fight the outbreak together.
The area of healthcare workers who are affected, President, is a matter of concern. I think Dr. Klute has clarified, has actually explained the challenge. But in fact, President, in the whole country, up to the 28th of May, the numbers of health workers who were infected would be 2,084. This is both public and private. And out of this, Western Cape is responsible for 80% of the health workers. And so that's really in keeping with the fact that this is now the epicenter in the whole country. And so whether we're looking at public sector health workers, which is about 80.7%, or the private and public sector together, which is basically about 81%. So that is really the feature in this province. That raised, therefore, the question of additional support, and we had this discussion with the MEC Mbombo and Dr. Klute, the HOD, that we now needed to get to make a call to the rest of the other provinces to give support. And already now you will notice that of the new recruits that are coming, a number of them are coming from outside other provinces such as KwaZulu-Natal and some of the other areas. And this is going to be the trend everywhere because the numbers of the demand on the nurses is going to be increasing. The Eastern Cape, we also 2 weeks ago got them, I think President was there, they'd already taken in over 800 new recruits, and the number also, similar number has been done here. We have gone further, President, and this has been again the work that we've been doing and led by Dr. Nicholas Crisp and Andrews in the head office. We have actually approached the private sector. So we've got a general broad agreement now with the Unity Forum for Family Practitioners, which is to agree that we will work together and bring in private sector players at every sub-district so that they can work and support our teams. And in this case, we've got a whole program that's going on now to look at the particular conditions under which they do the work. We've also been approached by the specialists who have also come on board and said, look, they also want to work with us. Obviously, their main issue has been around how they're going to be pushed into doing more work than which is outside some of their scope in terms of it's COVID, but everyone else must now focus on what to do on COVID, even though they are not necessarily physicians, internal physicians as such. So the issue of medical legal claims and the issues of lawsuits is under discussion, and we're discussing that issue. But we have therefore said that the province should be free to open up to recruit additional doctors from South Africa, and we've looked around, we're working with the Medical Association. They've just given me a list, and we've said we're not talking about generally any doctor, we're talking about those who are registered with the Medical Council or the Health Professions Council. We're working through that number. So nurses, doctors and other healthcare workers must be recruited, and therefore the question that where there's a limit, we also will have the overlap coming from the private sector. That we have agreed, President, as your instruction. This is a health sector. Both public and private were actually doing exactly the same thing, and so we're going to work together.